There is a one pipeline, very bigger pipeline like this, coming from the superior part of the brain. If this is the brain, so one pipeline coming from the superior part of the brain and bringing the impure blood. Okay. Then impure blood is collecting here in one cavity. Then it's directly going in the internal jugular vein. Okay. So this is the one pipeline. Okay. The second pipeline is coming from here on the lower side. The second pipeline is going like this. And it is also draining the blood to this cavity. Then again, it's going in the internal jugular vein. So there are two bigger pipeline. Okay. One pipeline in the superior part or the upper part. One pipeline in the inferior part. So superior pipeline is bringing blood from the upper part of the brain, and the inferior pipeline is bringing blood from the lower part of the brain. Because they are the veins, we are telling venous pipeline. And when the pipeline are very bigger, we tell them sinus. Sinus means bigger pipeline. It's like a very big space. So the pipeline which is coming from the upper part, it called superior venous sinus. And the pipeline who is bringing blood from the lower part, it's called inferior venous sinus. So we have to focus on two pipeline. Okay. What is the ultimate purpose? The ultimate purpose to bring the blood and put in the internal jugular vein. So let's see one diagram here. Yeah, look at now. If you see this, we can see how the one pipeline in the upper part. Just see this. Now you can see from the front side also. How this pipeline is located in the uppermost part of the brain, and it's going exactly in the center. In the acupuncture, we are telling it du meridian. So just below the du meridian, we are having this entire pipeline, and the name of this pipeline is superior sagittal sinus. Okay, we can see here. Now, one pipeline in the lowermost part, we can see here, that will be bringing the blood from the inner part, very deeper inner part. Okay. B, treat this line. We are working on the superior sagittal sinus, who taking the blood and draining in the internal jugular vein. And if we go a little deeper inside, one pipeline is going down, 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 or that is also going and draining the blood in the internal jugular vein. Okay. One pipeline coming from here. Both meeting at one place. Then finally, they are going in the internal jugular vein. So the name of upper pipeline is superior sagittal sinus. And the name of lower pipeline is inferior sagittal sinus. The superior sagittal sinus and the inferior sagittal sinus bringing blood from the entire brain, from the anterior part of the brain, from the middle part of the brain, and from the posterior part of the brain. So from the anterior part of the brain, all the veins, like all the cerebral veins, that is called anterior cerebral vein. And from the middle part, middle cerebral vein, and from the posterior part, this is the posterior cerebral vein. So the entire brain are draining the blood in these pipelines. Then finally, the blood is going in the internal jugular vein. In the osteopathy, this is the very important. Now we can see here. So the superior sagittal sinus and the inferior sagittal sinus are coming at this point. This is called the meeting point of sinus. Okay. So the meeting point of sinus here. Meeting means confluence. So this is called confluence of sinus. Okay. So at the confluence of sinus, when the entire blood is reaching, and after that, finally we can see it's going on the right side and the left side and reaching on the internal jugular vein. And after the internal jugular vein, it's coming in the brachiocephalic vein and finally reaching to the heart. Okay. So this is the eye. The eye draining the blood. Then this blood is reaching from both the eyes. This blood is going on one area. So from the right side, ophthalmic vein is coming. Ophthalmic means eye. And also from the left side, ophthalmic vein is coming. And the blood is getting collected at one place. The name of that area is cavernous sinus. Okay. So this is the one eye. This is one eye. Both eye bringing the blood, and blood is getting connected on the cavernous sinus. We know this is the pituitary gland here on the back side. So just all around the pituitary gland, there is a cavernous sinus. This is the pituitary gland. We can see pituitary gland. So pituitary gland, all around the pituitary gland, this is the right cavernous sinus, left cavernous sinus, anterior cavernous sinus. So the other both eye, one eye and two eye, second eye. The blood is going with the vein that is called ophthalmic vein and reaching to the cavernous sinus. The cavernous sinus is the area where pituitary gland is located. And here we are having 3, 4, 5th and 6th cranial nerve. Now from here, blood is going further in the next part. And finally, it's draining in the internal jugular vein. Then in the heart. Okay. So this is the internal jugular vein, and here is the cavernous sinus. So there is a one branch in between. Okay. This branch is called petrosal. What is the name? Petrosal sinus. So from the eyes, then the cavernous sinus, where we have 3, 4, 5, 6 cranial nerve, then the petrosal sinus, and then the internal jugular vein. Okay. I'm giving you 2 minutes. Write down the path of venous drainage of the eyes. Start now. How the blood is coming from the eye, then going where, then how it's reaching to the jugular vein. Write down quickly. You can write on the chat box or you can write down in the book and click the photo and send in the WhatsApp group. 2 minutes.